According to the American Diabetes Association, about 500,000 people in Louisiana have diabetes, and a large number of those people have no idea they have it. That's because some symptoms are easy to brush off, especially during the summer months. Dr. Brent Wallis from People's Health joins us now with some things you should be on the lookout for. Good morning.
Good morning,
Thanks
Nancy.
so much for joining us.
Thank you.
Well, what is diabetes?
So diabetes is a very common chronic illness. About 1 in 9 people in Louisiana have it. And it's actually caused usually either by too little insulin or no insulin in your body. So therefore you have to take medications to replace that. Insulin is used so that your body can actually metabolize and utilize the energy from sugars and carbohydrates.
And it's type 1 and type 2 diabetes, right?
Correct.
What's the difference?
Correct. So type 1 is usually more common in younger individuals, and those individuals don't make any insulin in general. So they always require injections. Type 2, which is the much more common type, we see in a little bit older patient, and those patients can be treated with insulin or pills.
So if there are no symptoms to diabetes, how do you know you have it?
So that's the scariest part about it. One of the most common symptoms of diabetes is no symptoms at all. And so what's most important is actually to speak to your doctor about whether or not you should be screened. Anyone who's overweight, who's between about 40 and 70, should be screened for diabetes at least every 5 years. And anyone who's got a family history of diabetes should be on the lookout for it as well.
But it can be dangerous, and the bad side of it is it can stop blood flow and circulation and those sort of things.
Correct, yeah. It can actually cause a lot of problems with your vasculature, so any of the veins and arteries, and especially your heart. So it can lead to heart disease, and actually without good blood flow, it can lead to poor wound healing and amputations even.
Yes, all right, well, there are some myths associated with diabetes, and I love this part because he always brings a test. All right, so the first myth, diabetes is caused by eating too much sugar. I would say that was, let's say, fact first, maybe.
So not exactly. That one's actually a myth.
Okay.
That one's a myth, and the reason why is that the sugar itself doesn't cause diabetes. What happens is sugar actually leads to being overweight. Being overweight leads to inactivity, and those are two major risk factors for diabetes. So the sugar itself doesn't cause the diabetes.
Okay, African Americans get diabetes more often than other ethnic groups. I would say that's a fact.
That is a fact. That is. So African Americans as well as Hispanic and Latino Americans have an increased risk of diabetes, and you'll see that when you look at their family history.
All right, if you have pre-diabetes, you will definitely get diabetes. I would say that's a myth, right?
That is a myth. So pre-diabetes, which is an elevated blood sugar but not high enough to be diabetes, can actually lead to diabetes, but the nice thing is that pre-diabetes is actually curable with treatment.
All right, so the swing thought is check with your doctor, make sure that you're okay, because the symptoms are sometimes non-existent.
Definitely.
Dr. Brent Wallis, thank you so much for joining us.
Thank you.
I did pretty good on the test. All right, time now for a check of the forecast with Shelby Latino.